Welcome to today's video. I'm Dr. Kobler, the urgent care doctor, and today we're going to discuss what urgent care medicine is, why it's important, and why I practice urgent care medicine. I have separated this video out into different chapters so that way you can maneuver through each of the sections as you please. I have also separated out the chapters into individual videos that you can see in the Introduction to Urgent Care Medicine playlist. With that, let's get started. We are going to start by defining urgent care medicine services according to the Urgent Care Association, or the UCA. The Urgent Care Association is the trade organization for the urgent care industry in the United States and abroad. It is partnered with the College of Urgent Care Medicine, Urgent Care College of Physicians, and the Urgent Care Foundation. The Urgent Care Association is also responsible for publication of the Journal of Urgent Care Medicine, which is the premier journal in the field. These organizations provide educational resources, complete research, and publish reports in the field of urgent care medicine. The Urgent Care Association also certifies urgent care centers across the United States and abroad, following nationally standardized criteria established by physicians and other experts in the field of urgent care medicine. The Urgent Care Association has currently accredited over 2,000 urgent care centers in the United States. This is the formal definition of urgent care medical services from the UCA. It is here if you'd like to take a look at it, but it's a little wordy and complicated, so I'm going to summarize this so it's easier to understand. Urgent care medical services can be understood in three parts. We treat and evaluate minor acute problems, which are non-life threatening or non-limb threatening injuries and illnesses. These services are usually provided in walk-in clinics with easy access and no appointment needed. And finally, we provide these urgent care medical services within the capabilities available at the urgent care clinic. So let's discuss this final part in detail since it is very important to understand in urgent care. Urgent care centers do not have all the same capabilities that an emergency room does. For example, urgent care centers typically have X-ray imaging, but they do not have advanced imaging studies such as CT, MRI, or ultrasound. Urgent care centers have some rapid lab testing, for instance, rapid strep test and urinalysis, which we get the results within about 10 or 15 minutes, but we do not have the capability of obtaining every single lab test within that same time frame. Urgent care centers have some medications which we can administer to patients on site, but not all medications that may be needed. And finally, most urgent care centers do not provide IV fluids or intravenous fluids. So, what is the scope of practice for urgent care providers? The scope of practice for urgent care is very broad, but in a nutshell, we take care of acute care problems. Acute care problems are illnesses and injuries that develop suddenly but are not life threatening or limb threatening. Within these problems, you can potentially see everything and anything. The range of conditions are from head to toe and encompass all organ systems and all age ranges. Every day is different. In a given day, I may see everything from common colds to lacerations to abdominal pain to skin rashes and everything in between. The range is endless. We also perform minor procedures and wound care, including laceration repairs, incision and drainage of abscesses, foreign body removal, and I've even removed a cockroach from a patient's ear. Yes, you heard me right. A cockroach was in a woman's ear and I removed it. I have a video discussing this case coming out soon, so be on the lookout for that. Anyway, back to the presentation. The urgent care that I work for also provides occupational health services. I evaluate and treat workers' compensation patients and complete DOT physicals, which are Department of Transportation physical examinations. The federal government requires truck drivers to receive medical clearance in order to work as commercial truck drivers. These are the DOT physicals which I perform. I also complete pre-op evaluations and perform school physicals and sports physicals. I see approximately 20 to 40 patients on a given 12-hour shift. The length of the shift can range from 4 hours to 12 hours, depending on need, and there is a great degree of variability on the number of patients I see, depending on several factors. These factors include the clinic location I'm working at, the day of the week I'm working, and the time of year. The national average is approximately 40 patients per 12-hour shift, so I am right there at the average. Urgent care centers staff physicians, MDs, and DOs, as well as advanced practice providers, or APPs, which are physician assistants, nurse practitioners, and advanced practice nurses. The physicians can be board certified in family medicine, emergency medicine, or internal medicine. The APPs typically have experience in these same areas of medicine. Depending on the state of practice and the specific urgent care company, the APPs can practice independently or under the supervision of a physician. Other urgent care staff include medical assistants, radiology technicians, front desk staff, and center managers who oversee and manage the day to day operation of the clinic and complete other administrative tasks. So, is urgent care medicine its own medical specialty? That is a complex question, which I can answer in a formal sense and in a practical sense. Formally, urgent care is not recognized as its own medical specialty. There is no standard training pathway for urgent care medicine, and there is no board certification specific for urgent care medicine. Rather, urgent care medicine is seen as a distinct delivery care model that is staffed by clinicians who have credentials or certification in established medical specialties. Practically speaking, urgent care is distinct in certain respects and is said to be part of family medicine, emergency medicine, and internal medicine. Let's take a look in detail, contrasting urgent care with emergency medicine and contrast urgent care with primary care medicine. Setting up the slide, you will see a Venn diagram, two circles with some overlapping yellow circles. Urgent care on the left and emergency medicine on the right. You can see that they are separate and distinct, but they do share a couple of things in common. The first big difference between urgent care and emergency medicine are the type of providers that work in these areas. I use the word provider to encompass both physicians and APPs. Urgent care providers can be trained in family medicine, internal medicine, or emergency medicine, versus emergency medicine providers are exclusively trained in emergency medicine. The next big difference between these two is the scope of practice. The majority of patients seen in the ER are having life or limb threatening injuries and illnesses. These are the patients who are the sickest and most in need of acute medical attention immediately. So, if you think about it, it makes sense that the ER has all the full capabilities of a hospital with all the imaging, labs, medications, and specialists on call to handle these problems. This is different from urgent care in that the patients that we primarily see have minor injuries and illnesses. This means that while the conditions in urgent care that we treat are important, the patients are not usually very sick or extremely injured. The next big distinction is the hours of operation. Emergency rooms are open 24 hours a day, 7 days a week. No matter the time or day, you can receive care in the ER. Whereas urgent cares are typically open for extended hours, but not 24/7. For example, the company I work for is open from 8 a.m. to 8 p.m., 7 days a week, and that is pretty typical for other urgent cares. The final big distinction between ER and urgent care is the cost and when payment is required. According to the Urgent Care Association, it costs patients on average $1,600 per ER visit, whereas urgent care costs patients on average $170 per visit. Most urgent care centers and ERs take all major insurances, so that helps with costs. In most cases, urgent care clinics require payment before medical services are rendered, unless the patient is having life threatening symptoms, such as chest pain, shortness of breath, excessive bleeding, or stroke symptoms. Those types of patients are evaluated and treated before payment is rendered. In the ER, payment is usually made after medical services are rendered. So, what does urgent care and ER share in common? This is represented by the yellow circles in the middle that overlap with each of the separate bigger circles. Both ER providers and urgent care providers take care of acute medical problems. But sometimes, what can initially be thought of as a minor acute problem can transition into a life threatening problem. This is represented by the red arrow pointing from urgent care to the ER. Let's look at a patient example. A patient comes to the urgent care and tells me that he's been having mild chest pain for the past couple of hours. The patient thinks he may have pulled a muscle while working out yesterday and wants to get checked out. I collect the rest of the history, obtain a set of vitals, perform a physical exam, and obtain an EKG. Uh-oh, EKG shows heart attack. I will then call EMS right away for them to be transported to the ER. So in this example, you can see that what was thought to be a minor acute problem was actually a life-threatening problem. This also shows that urgent care and ER work hand in hand when necessary. Urgent care and ER providers also practice preventative medicine by counseling patients on how to prevent disease and providing vaccinations when needed. Now let's take a look at the difference between urgent care and primary care. Setting up the slide, you will see another Venn diagram: urgent care on the left and primary care on the right. Urgent care providers can be trained in family medicine, internal medicine, and emergency medicine, versus primary care providers are exclusively trained in either family medicine or internal medicine. The next big difference between these two is the scope of practice. Primary care providers primarily see chronic care patients. These are patients who have long term health conditions that require ongoing management over months to years. Primary care providers establish a long term healthcare relationship with their patients over many visits and provide continuity of care management. This is different from urgent care in that we see acute care problems. This means patients come to be seen if they have a problem sporadically. I have rarely seen the same patient twice in urgent care unless it is for a follow up visit. The second big difference between urgent care and primary care is that urgent care has extended hours of operation. For instance, the urgent care that I work for were open 8 a.m. to 8 p.m. 7 days a week, versus most primary care offices are only open Monday through Friday, 8 to 5. One of the things that is shared between urgent care and primary care is prevention. Preventative type medicine includes measures to prevent disease and illness, such as vaccinations, counseling, and screening for disease. So, why is urgent care so important? Urgent care is important in the United States healthcare system for two main reasons. Urgent cares increase access to healthcare, and urgent cares decrease emergency department burden. Healthcare access is a big problem in the United States. Emergency rooms are increasingly crowded, and the wait time to see a primary care physician can be months. So here's a question: what should a patient do if they have a medical problem, but they cannot see their primary care doctor and they don't think the problem constitutes an ER visit? The answer: go to urgent care. It is this precise question that makes urgent care a great option for patients and decreases the ER burden. Here's another question: what if you recently moved and have not established with a new primary care doctor yet? What can you do? The answer: you could be seen in urgent care. There are so many examples of these gray areas in healthcare access that urgent care can help with. Urgent care provides convenient in-person access to healthcare like never before. According to the Urgent Care Association, there are over 15,000 urgent care clinics in the United States, serving over 200 million patients per year. The average wait time in urgent care is only 15 to 30 minutes, versus the average wait time in the ER is 2 to 4 hours. Urgent care provides easily accessible, walk in, high quality care that is affordable. The Centers for Disease Control and Prevention reports that 136 million people visit emergency departments each year. Studies estimate that approximately 30 to 50% of these emergency department visits involve non emergent conditions that could be managed effectively in urgent care or primary care settings. This leads to increased healthcare spending, overcrowding, and resources being allocated to those who do not need it. Urgent cares lessen the burden of ERs by taking care of patients who do not need ER services. This allows ER resources to go to those patients who need it the most. So now I'm going to discuss why I chose urgent care medicine as my profession. Please keep in mind that this is within the context of the urgent care company that I work for and does not represent all urgent care companies across the United States. These are some major points from my perspective. The first reason why I chose to practice urgent care medicine: patient variety. In medical school, we complete rotations in different medical specialties. Thinking back on that time, I would always say to myself that I would miss different pathologies from previous rotations. I would be on my psych rotation and think to myself, I really miss pneumonia. Or I would be on my surgical rotation and I would say to myself, yeah, this is really cool, but I really miss diabetes. Or I miss schizophrenia. I miss bipolar disorder. I miss pregnancy, etc., etc., etc. That's when I knew I had to go into a medical specialty that would allow me to see it all. Family medicine was that specialty. In family medicine, I was able to see all age ranges, all organ systems, and even take care of pregnant women. Urgent care allows me to go one step further and potentially see life threatening conditions. I like the idea of potentially seeing everything and anything. Which brings me to the second reason why I enjoy urgent care medicine: the diagnostic process. I have to figure out the diagnosis of this wide range of potential problems and determine the treatment plan within a relatively short amount of time. Despite not having all the resources of a hospital, I still can rule in and rule out a lot of disease processes, treat a lot of different conditions, and determine if a problem is life threatening. While this can be stressful at times, I really enjoy the process of figuring out the problem and getting to a solution. However, if I cannot diagnose the problem, or the problem requires a higher level of care, or the problem requires a treatment that I cannot do, then I will refer the patient to a specific specialist, the ER, or I will treat the patient the best way I can and have the patient come back for follow up. The next reason why I really enjoy practicing urgent care medicine is because I enjoy taking care of real world, everyday problems. So, what do I mean by this? In urgent care medicine, we see things that affect the average everyday child or adult. We don't typically treat or diagnose rare, exotic medical problems that only affect 1% of the population. Every single patient population is affected by the problems that I see on an everyday basis. I'm not going to diagnose some super rare, esoteric disease that is on the cutting edge of medicine, but I will see cough. I will treat somebody's back pain. I will be able to diagnose somebody's abdominal pain. I will figure out why somebody is having a rash, etc., etc. These are the problems that affect so many different people. I am very thankful that I can be the type of doctor that can affect so many people's lives in a positive way. The next reason why I really enjoy practicing urgent care medicine: minor procedures and wound care, laceration repairs, incision and drainage of abscesses, foreign body removal, and I've even removed a cockroach from a patient's ear. I have a video discussing this case coming out soon, so be on the lookout for that. Lastly, urgent care provides me the work life balance that I want. Urgent care is what is called shift work. This means that I am scheduled to work a set number of 12-hour shifts each week, but I do have some flexibility in the shifts that I choose, and I can also pick up extra shifts if I want to. Once the shift is over, I am done for the day. I am never on call in the middle of the night or any time that I'm not scheduled to work. It is this work life balance that affords me to make a great living while at the same time enjoying the life that I have. Just like everything in life, urgent care practice does have some downsides. There is very little continuity of care. The company I work for assigns me to different urgent care clinics each day. Therefore, the chances of me seeing the same patient twice is rare, which can be a good thing if you run into those not so nice patients. But this also means that I rarely see the outcome of a patient's treatment, which is something I do miss from my days working in primary care. Unfortunately, there is also no prior relationship with the patient. So there can be a lack of trust on both sides, and there can be personality clashes. I have learned how to build good rapport with my patients in the limited amount of time that I have, and so this helps to build trust. Does this work all the time? No, but you do what you can to provide the care that the patient needs. Even though there are some not great aspects of urgent care medicine, I am still very happy to be part of this area of medicine. So that's the end of the video. I hope this video has provided you more information about urgent care medicine and that you can see urgent care medicine in a different light than you have before. The references that I used are linked in the description below. Thank you for watching, and I will see you in the next video.